Alright, ladies and gentlemen, how are we doing? We are back to our NCLEX series. And this time around, we are back to maternity. You guys told me that you really loved maternity. So now, without further ado, let's get started. Remember, we always start with a short prayer. Almighty Father, we pray that we might pass this NCLEX with your grace and your mighty wisdom. We pray this through Christ our Lord. Amen. Alright, 11. The nurse is teaching a pregnant client diagnosed with TB about treatments during pregnancy and effects on her newborn. Which statement indicates that the nurse understands the client teaching. Number 1, my baby will be born with the TB and will be given Isoniazid or INH to treat the infection. Number 2, I will not be able to breastfeed or my newborn could contract TB. Number 3, I should take supplemental peroxidine during my pregnancy. That's the same as vitamin B6. Number 4, I will not take any meds to treat my TB until I have delivered my baby. What do you guys think? Remember, if I'm not giving you that enough time, remember to pause the video, then read through the MCQ until you get the answer. Alright, ladies and gentlemen, as you can see, the best answer here was number 3. I should take the supplemental pyridoxine during my pregnancy. What's pyridoxine? This is vitamin B6. Yes, the real babies need the baby really needs this to grow. But let's first look at the other options. Number 1, my baby will be born with TB and will be given Isoniazid to treat the infection. Is that why was the client teaching the TB and effects? No, TB can always be prevented in what? In pregnant ladies. So TB can always be prevented in a pregnant lady. So there is minimal chance that even actually TB can't even be passed on through the placenta. So let the client just get the medications, but the baby will never get TB. So the first part was wrong. Alright, number 2, I won't be able to breastfeed on my newborn or my newborn could not control TB. No. The mother will breastfeed, obviously. The only case where the mother is prohibited from breastfeeding is when the mom is HIV positive. That's the only type. But TB, any other infections, let them breastfeed as they take their medications. Number 4, I will not take any meds to treat my TB until, oh my goodness, TB is very deadly. There's no way you can wait until you deliver your baby. So the answer was number 3. Alright, next question. The nurse is assisting the CRNA, certified registered nurse anesthetist, in placing an epidural in a laboring client. Which findings would indicate the intravascular injection of the local anesthetic safe to order apply? How do you select to order that apply? True or false? What's the question asking? It's saying which one would indicate intravascular injection of the local anesthetic. That means they've instead injected the anesthetic drug in the blood vessel. So let's see, what are the side effects of anesthetics? Alright, number 1, tachycardia. Absolutely, yes. The anesthetics like lignocaine, all that stuff, they cause tachycardia and hypotension. Tachycardia and hypotension. Number 2, pruritus, which is the itching of the skin. No. Number 3, tinnitus, which is like ringing ears. Absolutely, ladies and gentlemen. Yes, it causes. Said one of the side effects of anesthetic drugs is ringing ears. Number 4, sedation. Now this was quite tricky. Sedation is not part of this because the effect was in the blood vessels. Had it been on the central nervous system, sedation would have come in. So that one is off. Number 5, business. Totally, yeah. Local anesthetics, where they put everything down. So business should surely be one of them. So the answer is number 1, 3, and 5. Alright, 13. The nurse is preparing to administer topical benzocaine to a client with a 4th degree episiotomy. Which intervention should the nurse implement? Rank them in order. What's episiotomy? Episiotomy is when a lady is giving birth and then they cut that perineal area so that to enlarge the what? The birth canal. So benzocaine, that's anesthetic. So which intervention should the nurse implement as is giving this benzocaine? Rank this in order. These are like common questions. So let's see. Number 1, position the client on the side with the top leg up and forward. 2, wash hands and don non-sterile examination gloves. Number 3, check the client's MAR with the identification band. Number 4, ask the client if he or she, if she is allergic to any lidocaine, benzocaine drugs. Number 5, applying the benzocaine to the perineal area. Rank is in order. Alright, let's rank together. Alright, the very first one, this is common knowledge. You have to first check whether this is the client. So you have to check the patient's identification band, the client's MAR. That's a special ID number. So you have to check whether that's the right client. Number 3, alright. Yes, what's the next one? Would you wash hands first or you ask the client if they're allergic? Absolutely, you need to ask the client if they're allergic because there's no need for you to wash hands and put on gloves and then go to the client and ask them, oh, allergic. No. So you have to ask them. So 3, then 4, then what else? Of course, 2, wash hands and don't sterile. So we are now left with 2 options. Positioning the client and applying benzocaine to the perineal area. Obviously, this is common knowledge, so you have to first position the client and put the leg up and forward. Then you apply the benzocaine very well onto the area that had episiotomy. So the answer is 3, followed by 4, 2, 1, lastly 5. Number 14, the client is in labor, has epidural catheter in place for anesthesia. Which intervention is most important for the labor and delivery nurse? Number 1, assist the client with breathing exercises during contractions. Number 2, ensure the client's legs are correctly positioned in the sterile wraps. Number 3, have the significant eye scrub for the delivery of the baby. Or number 4, titrate the epidural indications to ensure hierarchies. What do you guys think is the answer? If I'm so fast, kindly pause. Already, do have a keyword here. Intervention is the most important. Which one is priority? So, when the patient is undergoing anesthesia through an epidural catheter, obviously number 2. So, number 2 is the answer. We have to ensure the legs are correctly positioned in the sterile wraps. Why? Because remember, anesthetic causes and neurovascular compromise. That means like nabbing of these extremities. So you have to leave them in place before you actually have to apply the drug. So let's look at the other answer. Number 1, assist the client with breathing exercises during contractions. Very important, but doesn't take precedence over 2. These breathing exercises are very important during contraction, but remember we are giving anesthesia, not contractions. So, number 3, have the significant other scrub for the delivery of the baby. No, there's no need for the other spouse or the husband to put on all those scrubs and wait for the delivery of the baby. Number 3, titrate, because we are looking out for the most important. Number 4, titrate the epidural made to ensure an analgesic effect. This is not the role of the nurse because they said delivery. This is what the anesthesiologist or the anesthetic nurse will do, but not the normal RN. So meaning the answer was number 2. Alright, 15, which assessment data warrants immediate intervention for the client in labor who is receiving an oxytocin infusion via pump. So number 1, the uterus periodically becomes hard and firm. Number 2, the client reports an urgency to void. Number 3, the client denies the urge to push. Number 4, the fetal heart rate, does it return to baseline? What do you guys think? Alright, two of these two needs clarification. Immediate intervention is priority for the client who is in labor and receiving oxytocin. Alright, what do you guys think? This one looks obvious. Obviously, number 4, fetal heart rate not returning back to baseline. Oh my god, that's a red flag. What does this indicate whenever the fetal heart rate doesn't return? Now there's returning early, which is early deceleration. There's also returning late, which is late deceleration. And also there's when the contractions of the uterus are not aligning with the fetal heart rate of the fetus. So which is variable. So but then this one doesn't even return. That means there's no connection. There's some disconnection somewhere. It may indicate uterine rupture. This is an emergency. I have to rush the client to the ER. Let's look at the other options. Number 1, the uterus periodically becomes hard and firm. That's expected with oxytocin contractions. Number 2, the client reports an urge to void. This is normal because the uterus is putting pressure on the ladder. Number 3, the client denies the urge to push. Yes, this client is in labor and they may not have reached the last stage of labor, which they will feel as though they want to just get rid of this baby. So if they're not having that urge, that means still early. The cervical dilation is still in 2, in +3, not yet in 8, 10. So best answer was number 4. Alright, 16, the client who is 30 weeks pregnant and is diagnosed with preeclampsia is admitted to the labor and delivery area. The HCP has prescribed IV magnesium sulfate, to which data indicates the medication is effective. Select all that apply. How do we handle select all that apply? True or false? We deal each segment individually. So here we have a condition called preeclampsia. The HCP is giving magnesium sulfate. What shows that the med is effective? Number 1, the client has no seizure activity. Absolutely. But does preeclampsia entirely? It has, the patient is undergoing seizures. He has hypertension, severe hypertension. So the moment you give magnesium sulfate, that means you are mitigating those seizures. Alright. So current has no seizure activity. Absolutely, the med is working. That's great. Number 2, the client's urine output is 45 mL per hour. What's the normal one? It's over that. This is fine, but it's not indicative of magnesium sulfate. Clear that out. The client's BP is around 48/90. This is still high. However, this is not the action of magnesium sulfate. Number 4, the client's deep tendon reflexes are 2 to 3 plus. This is absolutely good because we are listening that seizure activity. That means we're also enveloping those reflexes, right? The normal reflexes are between 0 to 4. So if you're in 2 to 3, that means you're normal. Which is 0, then that means things are not good. Then 4, it's hyperreflexibility, which is not great. So the current pulse is 70 beats per minute. No, that's what magnesium does. So the answer is number 1 and number 4. Alright, 17, which statement best indicates the scientific rationale for administering corticosteroid therapy to a client who is 30 weeks pregnant? Guys, before we even answer the question, I'm gonna have to tell you the indication of corticosteroids in pregnancy, especially when we are not yet at term. Let's first get through the options. Number 1, steroids are administered to decrease uterine contractions in preterm labor. Number 2, steroids will increase the analgesic effects of opioid narcotics. Number 3, steroids accelerate lung maturation resulting in fetal surfactant development. Number 4, steroids will prevent the development of maternal antibodies to the fetuses. But what do you guys think? Alright, what corticosteroids do? Betamethasone, these guys, they improve on react fetal surfactant, thereby accelerating or improving on lung maturation. Actually, babies who are born when they are neonates, they are, I meant premature. Babies who are born prematures, the anesthesiologist or the intensivist will have to administer these corticosteroids called betamethasone via the endotracheal tube, so thereby improving their fetal surfactants. So number 3 is the answer. Let's look at the other wrong answers. Number 1, steroids are administered to decrease uterine contractions. What drugs decrease uterine contractions? First of all, we have butylene. Yes, but it's mostly beta-adrenergic agonist that do this. Also have a drug called Utrodrix, though it's no longer used, but the butylene is the best. So in cases when we have late deceleration, variable deceleration, administer drugs which decrease uterine contractions. Number 2, steroids increase the analgesic effects of opioid and narcotics. Really? Number 4, steroids will prevent the development of maternal antibodies to the fetus's blood. Will prevent the development of maternal. This is ROGAM. When the mom is rhesus negative and then the baby born is rhesus positive. So this one will prevent the development of these maternal antibodies so that the mother is able to produce a healthy baby on the second pregnancy. So meaning the answer was number 3. Very common question. Number 18, the client is experiencing postpartum hemorrhage and has received methyl-adrenaline. Client is bleeding out after giving birth. Which intervention is the priority when administering this medication? Yes, methyl-adrenaline. Basket is mode of action, and here we have it in postpartum hemorrhage. So number 1, check the client's hemoglobin and hematocrit levels. Number 2, monitor the client's peripod count frequently. Number 3, assess the client's vitals every 2 hours. And number 4, determine the client's vital height. What's the priority, ladies and gentlemen? If I'm so fast, kindly pause. Alright, the best way to assess this bleeding is number 2, monitor the client's peripod count frequently. Yes, I know number 1 was kind of tempting, but this is long term. By the time you measure the hemoglobin and hematocrit levels, oh my god, it's too far. But when you just monitor the client's peripod count, if this mother is able to soak like 3 pads in 15 minutes, oh my god, the bleeding is still there. So now if those pads keep on decreasing with time, those pads that are being soaked decrease within the 15 minutes. If the first 15 minutes there were 3, it's 15 minutes there are 2, next 15 minutes it's 1, that means the track is working. Okay, number 1, we had hemoglobin and hematocrit. Let's first get the normal hemoglobin. During pregnancy, these 2 levels are expected to be below. For instance, hemoglobin can even be 11, whereas hematocrit levels can be 33%, which is fine. The rest weren't needed for sure, because methylgenofin, what does methylgenofin do? This one is, it increases on the contractions of the uterus so that we can lessen that bleeding. Number 19, the pregnant client experienced a DVT, deep vein thrombosis, with her previous pregnancy. Which medication should the nurse caution administering to this client? select order to apply. What should the next question? How do we handle select order to apply? By handling each. So there is a false or what or true. Number 1, unfractionated heparin. That's okay. During DVT, which medications are wrong here is what we are looking for. Sulfaceous vascular node dependent thrombosis is when you expect clots in the veins due to this stagnated blood. Maybe the patient doesn't overwork. She's always in one place. High risk for DVT. So number 1, this is absolutely okay to be administered unfractionated heparin. Number 2, warfarin. Oh, that's category X. Very contraindicated in pregnancy, in as much as it's good for DVT, but not in pregnancy. Enoxaparin. That's okay. This is a medication which is fine to be given for DVT. Then rivaroxaban, dabigatran. No, it says these ones are all growth anticoagulants. However, they are category X. So meaning the answer is number 2, 4, and 5. Alright, number 20. The labor and delivery nurse is preparing the client for a scheduled cesarean birth. Which intervention should the nurse expect to implement or that apply? How do we handle or that apply? True or false? How should the nurse prepare the client for Caesar? Number 1, administer famotidine, or sodium citrate with citric acid. So this is a histamine blocker and thereby prophylaxis for gastric ulcers. Very great for any surgery. Number 2, perform an abdominal prep with antiseptic containing chlorhexidine and glucose. The guys, we need to, if that vancomycin resistant enterococci as well as the methicillin resistant streptococcus aureus. So you better prevent those infections. Number 3, give cephaloxin via IV piggyback. Absolutely, this is an antibiotic, prophylactic antibiotic. And they can also give metronidazole. Very great. Number 4, administer ondansetron IV. What's the indication of ondansetron? Metoclopramide, all those things to prevent vomiting, right? So there's no vomiting here. Number 5, on top of that, this client is PO before surgery, so there's no need for ondansetron. Number 5, perform a timeout procedure. What's a timeout procedure? Timeout procedure is when you're taking off the boxes before this client is being taken to the ER. So you have to make sure that this is the right client, not reaching there and then you operate the wrong client. So performing a timeout is very important. You have to cross check whether this is the right client, alright? So meaning the answers were number 1, number 2, and number 3. And number 5 as well. Alright, 21. The pregnant client is diagnosed with preterm labor and the HCP has prescribed nifedipine. What's intervention should the nurse implement or that apply? What's the indication of nifedipine? Nifedipine is a what? It's an antihypertensive, so it's given during preterm labor. What should the nurse implement here? They're looking for either for side effects or adverse effects. Okay. Number 1, take the refreshing of the skin and headaches can occur. Absolutely. Remember, nifedipine is acting directly on the blood vessels and it causes some sort of like vasodilation. That means you expect more blood flow to the skin. This can also cause headaches. Like I mentioned before, headaches are a result of vasodilation or even vasoconstriction. So yes, number 1. Number 2, administer the medication sublingually before meals. Nifedipine doesn't care about meals and it's not even given sublingually, it's given orally. Throw that out. because you're asking for the intervention the nurse should implement. Number 3, instruct the client very slowly after sitting or lying down. Feeding causes orthostatic hypotension. So speed is one to prevent those falls. Remember, NCLEX is safety exam. Number 4, discontinue medication if fetal heart rate increases 10 beats per minute over the baseline. Now, fetal heart rate, no, some apologies. The feeding it causes vasodilation. So it will cause this fetal heart rate to what? To increase by 10 beats per minute, but this is expected. This is a side effect. So there's no need to discontinue. You see, this side was correct, but this side was wrong. If the whole thing is wrong, the whole bit is wrong. That means that's number 5. Administer the client to avoid grapefruit or grapefruit juice. Advise the client to avoid grapefruit juice. So grapefruit juice increases on the absorption of this drug, leading to its toxicity. So you gotta avoid that. So the answers were number 1, we had number 3, number 5. Alright, number 22, the nurse is reviewing the laboring client's fetal monitor strip, which order by the HCP should the nurse question. What do we have here? Which deceleration do we have? Because this is one of them is the fetal heart rate, and here is the mommy's contractions. Alright, so just by seeing this fetal monitor strip, we would definitely conclude that. But however, which
section is this? Is this early deceleration, late deceleration, or variable deceleration? Let's first look at the options. Which order by the HCP should the nurse question? Number 1, initiate a saline lock or normal saline IV line. Number 2, administer butanol 1 mg IV push. Number 3, continue oxytocin infusion via pump. Or number 4, perform a sterilized vaginal exam. What do you guys think? Alright, ladies and gentlemen, this is early deceleration, very expected. Whenever the mommy's contractions increase, expect the fetal heart rate to do what? To decrease momentarily. However, this should happen simultaneously, which is early deceleration. So this is normal. So which order should the nurse question? What's the wrong answer here? Number 1, initiate a saline lock. We're already doing that. Number 2, administer butanol 1 mg IV push. Oh, this one, no, there's no need to administer this drug, alright? Yes, there's no need to administer, this opioid. But let's look at the other options. Continue oxytocin infusion. Absolutely, continue contracting this uterus because it's fine. Remember, oxytocin, pitocin, or methylgenovine, these ones cause what they call what? Uterine contraction. Number 4, perform a sterile vaginal examination. What for what? So number 2 was the answer. There was absolutely no need to administer this drug in this scenario. Alright, number 3, the nurse is reviewing lab data of a pregnant client in labor at gestation. Which intervention should the nurse implement? What should the nurse do when the nurse sees these values? So we are seeing DSWC, RBC, hemoglobin, hematocrit, platelets, ABO, rhesus factor, culture, rubella. So good enough nowadays, NCLEX gives you the normal values as well as the client figures. So that's what's happening in the new generation NCLEX. I think we shall talk about the new NGN. So number 1, administer Rogam immunoglobulin IM. Number 2, administer measles, mumps, rubella vaccine subcutaneously. Number 3, administer penicillin IV push. This is IV piggy bank. Number 4, administer 2 units of packed red blood cells IV. What's the priority here? Because I'm seeing so many values that are deviating from this. What do you guys think? What is the priority? What will kill the patient first? Pause if you need enough time. But anyways, if you look at through WBC's 11, when this is normal, it sounds okay, though at the edge. RBC 3.9. This is less, however, low red blood cells are expected in pregnancy. Hemoglobin 11. Let's look at the female. I don't know why they put males. I think the male ranges were just to confuse us. But here we are dealing with a pregnant lady. So this is less, however, expected. Hematocrit 33% is expected. Platelets 300, which is normal. Throw that out. ABO, which is A. Rhesus factor negative. Here we have positive. Oh my god. So here the answer should be 3. Administer penicillin IV pig bank. Why? Because we have this group B streptococcus which penicillin treats. Alright. So you have to give those penicillin drugs such as what? We have ceftriaxone. Yeah. So let's look at the other wrong answers. Administer Rogam IM. I know you were tempted to, because here we had a negative. However, if the mom is negative and then the newborn is positive, that's when you will administer. Yeah, we didn't have the rhesus type of the newborn. So whenever you don't have that information, stop assuming. Number 2, administer MMR subcutaneous. No, this is the pregnant lady, not the newborn. Number 3, administer 2 units of packed RBCs. RBCs is okay. This is the pregnant lady. That's not an emergency. But this infection, oh my god, treat it so fast. Alright, number 24, the client diagnosed with preeclampsia is receiving a magnesium sulfate infusion delivered vaginally despite oxytocin and fundal massage. The client is experiencing heavy bleeding. Which medication should the nurse expect to administer? Number 1, carboprostromethin. Number 2, methagenovine. Number 3, calcium gluconate. Number 4, lutrodrine. What do you guys think? So this client has preeclampsia. So you have to list all these conditions that the exam is studying because they are clues. There are some things to cancel out. Is receiving magnesium sulfate and is bleeding badly. Which medication do the nurse expect to administer? Whenever a pregnant lady is bleeding, you have to administer that medication that's going to contract the uterus to reduce on that bleeding. So you have to put off tocolytics like lutrodrine, terbutaline. So this one should be off. Alright, number 4 is off. So we have carboprostromethin, which is a good drug which contracts the uterus. That one in. So number 2, methagenovine. This one also contracts the uterus like pitocin or oxytocin. However, here's the catch. Here we have preeclampsia. This drug is contraindicated in hypertension because it will exacerbate the hypertension. Number 3, we have calcium gluconate, which is an antidote for magnesium sulfate. Magnesium sulfate is okay, there's no issues. However, we just need an adjuvant. So the best answer was carboprostromethin, which is number 1, simply because it will contract the uterus without causing any adverse effect like exacerbating the blood pressure like methagenovine. So number 1 is the best answer. Number 25, the nurse is teaching the client about medications and diet during lactation. Which information should the nurse include in the teaching? Select all that apply. How do you handle select all that apply? True or false? Number 1, avoid the flu vaccination while breastfeeding as it can expose the baby to influenza. What do you guys think? No, there's no need to avoid flu when the mother is lactating, when the mother is breastfeeding. So put that in so that you can even provide additional immunity to the baby. So avoid, throw that out. Number 2, do not take OTCs decongestants such as pseudoephedrine. What do you guys think? Absolutely. You see these OTCs, these ones, what they will do is that they will reduce on the milk production in the breast. So do not take them, please. Number 3, too much caffeine can cause irritability and wakefulness in the newborn. Absolutely, ladies and gentlemen. Yes, avoid caffeine, avoid so much of it when the baby is breastfeeding. Number 4, low dose aspirin, or even when the mother is still pregnant. Avoid caffeine at all costs. Number 4, low dose aspirin tablets can be taken as needed for mild pain relief. You see, aspirin causes Reyes syndrome in kids. What is Reyes syndrome? Think about Reyes, 2 eyes, meaning it will cause red eyes. So avoid aspirin when breastfeeding. Don't give aspirin to kids. Right, number 5, oral contraceptives containing estrogen should be taken daily to prevent pregnancy. No, avoid oral contraceptives when lactating, when breastfeeding, simply because they will lower on the milk production. So here the answer we had number 2. Yes, number 3, because for number 3 they were educating, and let me see, should be taken. So right here we had 25, we had 2 and 3 as the answer. Alright, number 6, the pregnant client, 26, the pregnant client diagnosed with bipolar disorder has been taking lamotrigine to have control symptoms. The client asks the nurse for information about the medication and pregnancy. Which information should the nurse tell the client? Select all that apply. Alright, select all that apply. How do you handle select all that apply? By either true or false. Lamotrigine is a preferred treatment for bipolar affective disorder in pregnancy. Absolutely. Lamotrigine is not control indicated in pregnancy. So if the pregnant client has bad bipolar affective disorder, kindly give this drug. Number 2, medication dosage may need to be increased during pregnancy. Absolutely, it has to be increased during pregnancy, alright? And then when baby gets delivered, it will be reduced. Number 3, serum lamotrigine level should be obtained every 4 weeks in pregnancy. Absolutely, ladies and gentlemen, we have to measure these levels so that we don't give toxic levels. Number 4, breastfeeding is contraindicated with lamotrigine. No, like I said, the only time breastfeeding is contraindicated is when the patient has HIV. Alright, number 5, lamotrigine causes no significant increase in birth. Absolutely, it doesn't cross the placenta, so it causes no issues in pregnancy. So the answer was number 1, 2, 3, and 5. Alright, let's go to the newborn client transition to extrauterine life. So these ones are gonna be more of, the newborn, the one was transitioned from being called a fetus to now a newborn, has now started their life on earth. Number 27, the nurse is caring for a newborn client who received naloxone hydrochloride IM intramuscular at delivery. This assessment data indicates the medication is effective. So the newborn is getting naloxone at delivery. Number 1, axial temperature at 98.3 degrees Fahrenheit. Number 2, heart rate regular at 120 beats per minute. Number 3, respirations irregular at 40 beats per minute. And then number 4, blood pressure at 70 out of 40 millimeters of mercury. Remember, all this it's about a newborn. And why is even naloxone given when the baby is young? Why? So what shows that the med is effective? What do you guys think? Alright, ladies and gentlemen, the answer is number 3. Guys, remember, naloxone is given when the baby is lethargic. This is the mother who has been on opioids for so long, so they are given this. Naloxone is an antidote to what? To opioids. So whenever the newborn is given naloxone, that means he or she is paying for the sins of the mom who has been on opioids for so long. So whenever we have those irregular respirations, remember, irregular pattern of respirations in newborn, it's normal, and then we have this 40 to 60. Remember, the normal is 40 to 60. So if we have 40, that's fine. Breaths per minute, respiratory rate in kids, 40 breaths per minute, that's fine. Let's look at the other options. Temperature. Naloxone has no issue on temperature. Heart rate, this is normal, but it has no effect. Blood pressure, it has no effect. So it had the effect on 3. 28. Which statement best indicates the scientific rationale of administering erythromycin or ophthalmic ointment for newborn? Remember, these newborns are born, they are given erythromycin ointment. So why? They are also given tetracycline. Over in this case, we have erythromycin. Why? Let's look through. Erythromycin prevents ophthalmic neonatal in infants of mothers with gonorrhea. Number 2, erythromycin prevents otitis externa in infants of mothers with HSV. Number 3, erythromycin prevents transient strabismus in infants of mothers with chlamydia. Number 4, erythromycin prevents blindness in infants of mothers with cytomegalovirus. What do you guys think is the answer? Alright, the answer is number 1. Erythromycin prevents what? It prevents ophthalmia neonatal in infants of mothers with gonorrhea. Absolutely, this was the answer. Why? So the mothers who have been suffering with gonorrhea, remember they have this cause organs which is called Neisseria gonorrhea. So it can be passed on to the kid, and then the infant can have ophthalmia neonatorum. So giving a prophylactic antibiotic like erythromycin will definitely prevent this condition or even disease. So the other options are wrong. However, if you look at 4, prevents blindness in infants of mothers cytomegalovirus. Yes, cytomegalovirus causes blindness, but it's not prevented by erythromycin, which is an antibiotic. So it treats bacteria, not viruses. So the answer was number 1. 29. The nurse is caring for a healthy newborn client. Which vaccination should the nurse expect to administer before the client is discharged? Alright, which medication is given at birth? Alright, number 1, Haemophilus influenza type B. Number 2, MMR. Number 3, DTaP. Number 4, Hep B. What do you guys think is the answer? Alright, the best answer, if Perry was there, Perry would have been chosen. However, we have 4. Number 4, hepatitis B is given at birth. Hepatitis B is very, very deadly, so it has to be given right away. Let's look at the rest. Haemophilus influenza type B, this is given at 2 months. MMR is given at 12 months. DTaP, diphtheria tetanus, and pertussis is given at still 2 months, just like Haemophilus influenza type B. So at birth we have hepatitis type B. So you have to actually know your chart, know your vaccination chart. You never know when the question can come out. Then we have number 30, which is gonna be the last. The nurse is preparing the newborn for circumcision using a gomico clamp. Which interventions should the nurse implement? Select all that apply. How do we handle select all that apply? By choosing each answer, whether it's true or false. If it literally answers the question, so the nurse is looking for those interventions to do when this client is circumcised using the gomico clamp. Number 1, ensure vitamin K was administered at birth. Absolutely. It's just ensuring. It's not giving vitamin K, it's ensuring that it was given. So vitamin K, what does that do? It reduces that bleeding. Remember, this child is going to be circumcised, is going to go this penile surgery, which can cause, bleeding. Remember, the So after effects of surgery, bleeding is one of them. Infection, we have, bleeding, infection, as well as many others. So basically, one is correct. Apply a kinetic mixture of lignocaine and pilocaine. Absolutely, you have to, reduce this pain stress. So two is correct. Give 2 ounces of glucose water for pain. No need. Number 4, obtain petroleum gel to place on the penis after procedure. Absolutely. Petroleum gel is very important so that this wound can dry faster. Especially in this type of what? Circumcision, the comical clamp. Administer acetaminophen orally prior to the procedure. Absolutely, so that you can actually reduce that pain. Right. So that marks the end. I hope you guys gained something. What has been your score? We've had 20 questions. What has been your score? Thank you so much for sticking, and make sure you subscribe to this channel because there are a lot of valuable content. We have to interact, ladies and gentlemen, so that you can actually support each other. Thank you so much for watching.